Hi, I'm Andrew Bort with the Institute for the Advancement of Group Therapy, and our mission is to help more patients heal and find lasting recovery through elevating group therapy in a way that uses the neuroscience of learning to maximize patient engagement and skill building. We're going to be looking at a few alternative delivery methods. One that you're probably very familiar with, the one that's delivered at most facilities across the country, followed by another way, another approach. In this first one, we're going to look at the standard check-in, the check-in of round robin, where one patient talks at a time. In the next one, you're going to see a find someone who activity where patients are up and moving around the room. Notice the differences in patient engagement, in patient talk time, and also in what the facilitator is doing. Thank you so much, everyone, for coming again. We are going to begin with our check-in today, and so I want you all to be thinking about how you're feeling on a scale of 1 to 5. 1 being the lowest, and 5 meaning you're feeling pretty good. Okay, and so we're going to start with Sharisa. Sharisa, how are you feeling?
How I'm feeling today, man, not super great. I guess if I were to put it on the 1 to 5 scale, maybe like a 2 or 3. I have this diagnosis. I told my husband that. He didn't appreciate that very much, but it was a good movie, though. Yeah.
Okay.
Kind of brought my spirits up, I guess.
How about you, Drew? 1 to 5, how are you today?
Today, about a 2, I would say.
Why is that?
The weekend was kind of dumb. Did a lot of work. All I wanted to do was drink all weekend, and I just kind of got through it, and now I'm here.
Notice how, in this example, after 20 minutes, we only got through 2 individuals. Did you see how the other patients were disengaged, playing on their phones, or just not paying attention at all?
It's tough.
Yeah, and just gritted it out. But, I've only been sober for like a week, so.
Well, thank you, everyone, so much for coming back. It's nice to see you all again. We are going to start with our standard check-in, but we're going to do it a little differently today. I still want you to think about your mood on a scale of 1 to 5, 1 being the lowest and 5 being the happiest you've been. This time, we're going to stand up and we're going to talk to each other. Okay, you're going to find a partner in the room and you're going to share with them your number and the reason why in 1 to 2 sentences. Now, it sounds pretty challenging. Okay, so are we just going to be sitting down?
No, we're standing up.
Standing up. Okay. How many sentences are you going to share with your partner?
1 to 2.
1 to 2. Here's the last thing. I want you to talk to at least 3 different people before we finish. Okay? So when I tell you switch, find someone new. All right. Let's go.
Piece of metal in my tire.
Okay, please switch. Switch, find a new partner.
Hi, partner. Hi. How are you? Good. How are you? Good.
Now notice how engaged the patients are here. They were still sharing check-in questions, and the therapist was still facilitating by walking around, listening, and supporting. But every patient was engaged, and the patients were even able to learn and support each other, just like what needs to happen in the real world once they complete therapy and the therapist is no longer present.
Yeah,
Okay, so what numbers are you at?
I'm a 1. I'm just tired of.
I'm a 2.
1 and a 2. Okay.
Yeah, you get a depressed room, man.
All right, we're going to switch one more time. Find your last partner. In this next module, we're going to look at motivation in practice and how to motivate groups to engage in the activities and the topics that you want them to. The first time, once again, we're just reading the standard definition and starting with elicitation questions. In the second one, we start with commonalities and ways that we can get the patients involved and connected to their own life experiences and motivated to participate. Okay, so our topic today is going to be epigenetics, okay, which is the study of how your behavioral and environment can cause changes that affect the way your genes work. So several lifestyle factors have been identified that might modify epigenetic patterns such as diet, obesity, physical activity, tobacco, smoking, alcohol consumption, environment, pollutants, psychological stress, even working night shifts. So we know that some people may have a higher genetic propensity for addictive behavior.
We're watching the facilitator read a complex definition from a manual to a disengaged room. There is no way to know what patients know about the topic because only the facilitator is talking, and no one is motivated to participate or engage the topic.
Influence the decisions that you're making now.
I think I'm gonna try and eat better and quit smoking.
Okay, so sticking with our theme of epigenetics, do you know anyone who has found recovery successfully? Keith, how about you?
Yes.
Yes. Okay. And do you know anyone who has found recovery? John?
Kinda.
Kinda?
Yeah.
Okay, so yes. Do you think that people who leave treatment, do you think that they find recovery? Do you think it's possible for them? Drew, what do you think?
Do I think it's possible?
Yeah.
Yeah.
Okay, so what
In
does
this
tell us
example, we
about-
watch the facilitator connect the session topic to the patient's life experience and background knowledge about others with similar struggles who found recovery. The facilitator uses an engagement technique of random toss to keep everyone's attention.
Yeah, I'm gonna repeat the cycle forever. That's what people like me do.
Well, but we just heard from the rest of the room that recovery is absolutely possible. Some of you know people who have struggled with substance use in the past and have found recovery. You know, a lot of the counselors who work in this field have struggled in the past and find recovery. In fact, you might be surprised to find out that 75% of people who struggle with substance use at one point in their life actually find recovery. Does that surprise you to hear that kind of stat? Let's go back.
It does surprise me.
Does surprise you. But what does this tell us about how genes work? What does it tell us about how genes work?
That they can change.
Yes, that they can absolutely change. In our next module, we're going to look at the difference of reading with a focus task and without it. Notice in the first example, all of the patients that are not reading. What are they doing? Does this remind you of what goes on in your groups? The next time we look at this, we see the patients who are not reading all have a job to do. What are they doing now? And in the final activity, it's the same article, but it's scrambled up. So each of the teams are working together, and in addition to consciously paying attention to the material, they are also practicing assertive communication, building empathy, and working as a team. So we've been talking a little bit about brain changes and, you know, the fact that it's true when you do drugs, it can change your brain, okay? But that's only part of the story because in reality, everything we do changes our brain. And so we're going to learn a little bit about that today. I have a document that I've passed out. I would like you to start reading it, just the first paragraph, and then we'll just kind of pass it along.
So it says, learning styles as a myth. Learning styles refer to the idea that students learn best when course content is pitched to match students' self-reported media preferences. Endless potential frameworks for categorizing learning styles exist, but the most popular one divides students into three types.
Each patient has the text. Some read along, some read fast and finish early. Many simply daydream until it's their turn to speak. Patient attention and engagement are lost.
Finds visual content less helpful than auditory material.
Okay, next. So, thank you so much for coming again. We are going to continue talking about how we can influence the changes in our brains. And so, Sharisa is going to read us an article. And while she does that, I want you all to be considering one question that you have and one statement about the article. Now, it can be something you agree with or disagree with. So, how many things am I asking you to consider in total?
2.
2. What are they?
A question and a statement.
Question and a statement. Okay, Sharisa, please.
All right, learning styles as a myth. Learning styles refer to the idea that students learn best when course content is pitched to match students' self-reported media preferences. Endless potential frameworks for categorizing learning styles exist, but the most popular one divides students into three types: visual, auditory, and kinesthetic learners. According to this theory, a self
Here, only one group member has the text, and listeners are given a focus task to ensure active listening. All group members are engaged.
material. Yet the overwhelming consensus among scholars is that no scientific evidence backs this quote-unquote matching hypothesis of learning styles.
Okay, so once again, we are talking about the different ways that we can change our brain and the influence that we have over those behaviors. I have an article here that I think you're going to find very, very valuable. The problem is it's all cut up and organized into many, many different parts. And I think that this is too much work for one person to accomplish on their own. So I'm going to put you in teams, and we're going to see who can put these in the right order first. Yeah. I see a little bit of nerves over here. That's okay. You're going to have two people to support you. You're all working together. All right. So can I have this team come up, and your piece is going to be over here. Please don't start until I tell you to. Your team is going to come up over here. You can just kind of sit on the floor. Oh, yeah.
Oh, we are sitting on the floor. I was going to pick it up and start pulling down.
Ready?
Okay.
And begin.
In this final example, the teams work together to put the article in the correct sequence. In order to accomplish this task, they must read the content deeply for understanding. Consider the other skills they are building during this collaborative effort.
Examples might be
Recommendations are probably.
Oh, that goes here, that goes here.
3 types.
In the next module, we're going to look at checking understanding through concept checking questions. It is very common for what's going on in a patient's head to be different than what the clinician thinks they actually understand. And so one way to verify is through concept checks. Notice the first time through, we just ask, do you understand? Everyone says yes. When we introduce the concept checks, we are asking targeted questions to make sure the patient understanding is really there. We can compare good and bad examples. We can ask them for examples, open-ended questions, and targeted questions to really see if those sticking points have been overcome. Okay, so today we're going to be talking about I statements. And for those of you who don't know, I'm just going to read you a brief introduction. Okay, so when you're in a conflict, you may have difficulty clearly articulating your situation without escalating the conflict. So using an I message or an assertive statement, these can help you state your concerns, feelings, and needs
In this example, once again, we watch the facilitator read from a manual, and we don't know what patients are thinking or what they understand. Remember, just because someone tells you they get it doesn't mean they actually do. The facilitator must verify.
You're going to state an observation, connect it to a feeling, then a need, and what you hope the outcome can be, so your preference. All right? So do you understand what an I statement is now? Can an I statement start with you?
No.
Okay. Actually, it can if it's connected to an observation. Okay, and so this is why it's important. In the way learning works is people's brains start automatically looking for patterns, right? And so if patients are off to...
In this example, the facilitator checks for sticking points by asking targeted questions, eliciting examples or components of the topic. This will allow the facilitator to back up and clarify before patients continue down the wrong path.
So an example might be, when you come home late, I feel very anxious and insecure because I'm afraid you might leave, right? And so in this case, when you come home late, we're stating an observation as fact, right? Okay, do we use I statements in an attempt to get our way or change another person's behavior? No. Wonderful. No, they are designed to communicate our own feelings and needs. What are some of the compounds of a successfully created I statement?
A feeling, the hope for an outcome.
Okay.
Maybe not the expectation of it.
Sure. Okay. There are two more. About Keith.
A need and kind of an expectation or what I want.
Okay, well, yeah,
An outcome.
close. A hoped outcome necessarily, a preference, not necessarily. In this next module, we're going to look at maximizing skills practice in context. In the first example, you'll see the patients working through I statement worksheets. While these kind of activities will help with procedural learning, they won't help the patients develop the unconscious automated processes or appropriate practice to use these skills outside of the treatment space. Anyone can create an I statement in isolation in a quiet space, but it's much different if you're being yelled at. In the next example, we have them going through a mingle or a role play where they are practicing different real-life scenarios, and they don't just do it once. They do it again and again with different people and different scenarios. This helps with real-world practice, contextual practice, and problem solving, setting them up for success when they leave the treatment space. Okay, so sticking with our practicing of formulating I statements, I've passed out a worksheet to each of you. I'd like you to work on that now.
In a real-life situation, no one is going to wait for a patient to stop and check what they filled out on their worksheet. So while this simple performance task will increase knowledge about the topic, what patients really need is skills practice.
We're going to be doing a role play, all right? And so continuing our topic of I statements, you're going to be practicing using those in real-life contexts. So I'm going to pair you up. So what you're going to do is you're going to find your partner, and if you want, you can stand up and you can move around, kind of go to different parts of the room because we don't want the conversations overlapping too much. And you're going to read your scenario card, and then you're going to start your conversation, all right? All right, so 3, 2, 1, get started. Stand up, move around. We can have you guys come over here.
So do you now do an I statement?
Notice the engagement in the room and how everyone is actively involved in a conversation mimicking a scenario they might actually face when they leave treatment. Formulating an I statement on the spot demonstrates mastery of the skill.
At the bar with other staff who were out that day.
So you were the,
When you talk
you're
like
the
that,
child and he's upset. In our final module, we once again look at patient practice and skill development in context. So our first example sees patients playing it through one at a time. Again, focus on how many patients really get to practice through this activity, and what are the other patients who are not practicing? What are they doing? What are they thinking? In our final activity, you'll see a maximizing practice through speed dating, where the patients will pick up a card and practice playing it through before they soon rotate and do it again. We're also having the other teammate give them feedback, positive or negative, helping to reinforce those neural links and build community and assertive communication. Okay, I want to continue our discussion on playing the tape through. Okay, so I've passed out some task cards. What I'd like you to do is I'd like you to read it and then give us the next 2 or 3 events that you think might happen.
The opportunity arises for me to take credit for somebody else's work. Though they may never find out, you think the recognition could help advance your position in the company. I'm gonna not take credit for it.
Okay? And why? What might happen if you decide to do that versus not doing it?
I think I'll just feel really guilty, and then I'm just gonna want to drink.
So you're going to make the correct choice here. What do you all think?
Sounds like the right choice.
Sounds like the right choice. Okay, Drew, thank you so much.
My scenario is
In the round-robin style of facilitation, after the first patient reads, there is no incentive for patient 1 to continue engaging. Furthermore, at the end of the line, every patient has practiced the skill 1 time.
them if I had one.
Okay. What are some possible consequences of getting in a physical altercation in a public place?
Get arrested.
Okay. Okay, fantastic. So we are going to be practicing our skill to play it through, and this time we're going to do some rapid fire practice. So we really want you to be able to hone those skills and really get them ingrained into your head. Okay, so when I say go, you're going to pick up your card, and this row is going to read their card to the partner, and then they're going to play it through, and this row is going to give feedback. Then we're going to swap. Okay. And after both sides are done, everyone's going to stand up and rotate, right? So, which side is reading first? Raise your hand. Which side? Yes. 3, 2, 1, begin.
Just received some.
All right.
In this example, patient talk time, engagement, and skills practice are maximized. In the same amount of time it took patients to practice their skill once, each patient practiced the skill 6 times with 6 different partners getting feedback each time.
Maybe I would have
I
to move
say,
myself
I'm
a
allergic.
bit.
Thanks anyway.
Maybe I just tread water for so long.
Celebratory?
Okay.
Hey, that's 2 for
I think I'm
you
just
found.
gonna,
Maybe I'm just picking on
leave
you.
it at that.
Oh, celebratory. Okay.
Cool.
Okay.
All right.
Thank you so much, and we hope that you can take away some of these skills and tools to help better engage your patients, maximize your groups, and help more patients heal and find recovery. Contact us at grouptherapycertification.com or email certification@grouptherapycertification.com. Thank you so much.